Hello, my name is Kerry Grimes. I'm a service support pharmacist with CPNI. Welcome to the training webinar for the Pharmacy First service for winter ailments, sore throats and common cold. A Pharmacy First service is whereby patients are encouraged to consult with a participating community pharmacy rather than contacting their GP or out of hours for a defined list of common conditions. The pharmacist will give advice and, if appropriate, supply medicines from an agreed formulary or refer the patient to the GP if necessary. Medicines, when deemed necessary, are supplied free of charge. The Pharmacy First service has been provided by community pharmacies in Northern Ireland since November 2018, when it was introduced to manage sore throats, colds and flu-like illnesses over the winter period. For winter 2020-21, changes to how the Pharmacy First is delivered are required due to the ongoing COVID-19 pandemic. From the 2nd of November 2020, the Pharmacy First service will commence for the management of winter ailments, sore throats and common cold, and for the remote management of COVID symptoms. The Pharmacy First service will continue to be developed with a urinary tract infection pilot due to commence early next year. The management of these conditions will continue until the 31st of March 2021, but please note that this date may be subject to change as the pandemic continues. The aim of the Pharmacy First service is to displace activity, including consultations, advice and generating prescriptions for common conditions from general practice to a community pharmacy-based service. The objectives are to reduce prescribing for sore throat and common cold and reduce the number of general practice consultations for these conditions. Support the cost-effective use of medicines and health service resources in primary care. Provide advice remotely to patients with COVID-like symptoms and promote the role of the community pharmacy as the first port of call for the management of these conditions. The Pharmacy First service is available to any person registered with a GP in Northern Ireland. Each Pharmacy First consultation must be carried out by an appropriately trained pharmacist, and the consultation may take place by phone, video conference or in person in the pharmacy at the discretion of the pharmacist. Prior to the COVID pandemic, the service specification required patients to present in the pharmacy for a consultation with the pharmacist. The service specification has now been updated to include the use of telephone or video consultations. This update has been introduced to take into account the needs of the vulnerable members of the community, patients who are continued to shield and patients who are isolating due to symptoms of COVID, confirmed diagnosis of COVID or a household contact, or on advice from Northern Ireland Test and Trace Service. All consultations carried out by video call should take place via the pharmacy's HSE Zoom account, as this enables the most appropriate security settings to be applied to all HSE users of Zoom. Details on how to apply for a HSE Zoom account can be found on the BSO website, and £800 grant funding was also made available to facilitate video conferencing. We will all be aware of the symptoms of COVID, which include a high temperature, new continuous cough or loss of taste or smell. The consistent message remains that patients with COVID-19 related symptoms should not present at a pharmacy. All Pharmacy First service related communications to the public will continue to reinforce this message. The service guidance outlines steps which should be followed if a patient displaying COVID related symptoms mistakenly present at a pharmacy for any reason. Unless the patient is or becomes extremely unwell, they should be asked to leave the pharmacy immediately and provided with a coronavirus advice sheet. Instead, they or a representative should contact the pharmacy by phone for a consultation with the pharmacist. If a patient with COVID symptoms or the representative contact the pharmacy by phone, they should be advised to book a coronavirus test via the gov.uk website or by calling 119 in the first instance. Advice should be offered from the coronavirus advice sheet, which is an appendix 2 of the service guide. It is recommended you advise patients on testing and isolation requirements, symptom management, treating a high temperature and cough, and how to avoid spreading infection and what to do if a patient condition deteriorates. When a patient or carer contacts the pharmacy with symptoms of a sore throat or common cold and are eligible for the Pharmacy First service, the pharmacist should carry out an assessment. The pharmacist will consider the most appropriate course of action. This might involve the provision of advice and reassurance alone, or the provision of advice and reassurance alongside medicines which may alleviate symptoms. In some cases, the pharmacist may consider that referral to another healthcare professional is indicated. Using the Winter Ailments advice sheet, which is Appendix 4 of the service guide, the pharmacist assesses the symptoms in order to determine the cause and severity of the ailment. Having done so, they will advise the individual or their parent, guardian or carer of the nature of the ailment, the symptoms to expect and the expected durations of the ailment, and any requirement for follow-up or any steps that can be taken to alleviate the symptoms. Patients can also be directed to the patient zone of the Northern Ireland formulary, which has a variety of patient information leaflets covering the following areas: sore throats, do I need an antibiotic, and does my child need an antibiotic? On some occasions, the pharmacist will decide that an individual's symptoms are such that a supply of medicine is indicated. Where this is the case, the medicines should be selected from the agreed formulary in Table 1. Where an individual expresses a preference for a product which is not included in the agreed formulary and the pharmacist considers that such a supply is appropriate, the pharmacist is able to sell the patient that product and the consultation will still be considered to be within the terms of service, provided a record of the consultation is made. Products should not be supplied for patients displaying COVID-like symptoms. Where a medicine is supplied, it shall be appropriately labelled and the pharmacist shall counsel the individual regarding its safe and effective use. Where supply of a medicine and/or written patient information is indicated for the patient following a telephone or video consultation, arrangements for collection of these items must be agreed between the pharmacist and the individual. When medication is supplied, the pharmacist must complete and sign the pharmacy voucher at the time of the consultation. The pharmacist must use the pharmacy voucher supplied for the minor ailment service and not the NCR duplicate PV supplied for the emergency supply service. The pharmacy voucher should be accurately coded for any medicine supplied using the usual product codes from the Northern Ireland Codebook. The pharmacy voucher must also be coded with the Pharmacy First code 97003/1. Pharmacy vouchers must be bundled separately from the normal prescription forms and forwarded to the BSO with the second monthly submission. A record of every Pharmacy First consultation must be made on the monthly record form on the date of each consultation. A printed patient bag label can be used to record the name and address of the patient and the date of the consultation. The patient's date of birth must also be recorded and all relevant boxes ticked. Each individual pharmacist, including locums, will need to sign their name. A copy of all the monthly record forms relating to the previous month must be scanned and emailed using the pharmacy's HSC secure email address to your local office on the date of the second monthly prescription submission. Email addresses of local offices can be found in the service guide. As the records contain patients' personal information, they shouldn't be posted to the local office. The original record form should be retained in the pharmacy in line with the department's good management and good record guidelines. As a result of the consultation, the pharmacist may consider the patient requires referral to their GP practice. Local arrangements should be agreed in advance between the community pharmacy and the GP practice for dealing appropriately with individuals requiring referral. Where possible, the GP practice should nominate a member of staff who will manage referrals from community pharmacies. But some things for you to consider. The pharmacist advises the patient to contact the GP practice by phone. The GP practice to consider prioritising patients who contact the practice following a Pharmacy First consultation. The pharmacist phones the GP practice to arrange a more urgent follow-up phone call from the GP to the patient. And the pharmacist completes the referral form and securely transfers this to the GP practice. Individuals may be advised to contact their GP in the event their symptoms do not improve within the normal expected timescales or if their condition deteriorates. Remuneration for Pharmacy First service provision will be based on a capitation model. Initial funding of £200,000 per month has been made available to set up and deliver this service in Northern Ireland from the 2nd of November 2020 until the 31st of March 2021. Service funding will be allocated to pharmacies contracted to provide the service on the following basis: 1/3 divided equally amongst contractors. The remaining 2/3 will be allocated on prescribing volume based on 1920 dispensing data. Products will be supplied via the PV1 forms, will be reimbursed by BSO in the usual way, including dispensing fees. Monitoring of service activity will be an important part of the service evaluation and will comprise of the following 2 elements: PV1 forms submitted to the BSO and the monthly record forms, which is Appendix 6, which should be completed for every patient and returned by email to the local HSCB office on a monthly basis on the date of the second submission. In order that the Health and Social Care Board, ourselves at CPNI and the Department of Health can continue to work collaboratively, is to secure funding in the future for the Pharmacy First service. So it is essential that all activity associated with this service is recorded on the monthly record forms and submitted in a timely manner. We collectively need to demonstrate that this winter's Pharmacy First service is providing value to the health service. Therefore, I would urge you to capture all consultations and advice provided through the service. This way, we can clearly demonstrate the value of community pharmacists in helping deal effectively with patients who would normally consult their GPs for common conditions. As pharmacists, we are best placed to deal with common conditions, offering advice and recommending over-the-counter products or referring patients to other healthcare professionals as appropriate. Further training is available to support you with Pharmacy First from NICPLD, which includes a 2-hour recorded lecture on remote consultations. NICE also have training available on the common cold, acute sore throat and sinusitis. The Health and Social Care Board will provide promotional materials for use by community pharmacies providing the service, which will include 2A4 and 2A3 posters, and they'll be available in printed and electronic format, and then a leaflet which is available in electronic format on the BSO's website. I would also encourage you to add details of the service to your pharmacy's social media platforms. Keep an eye on CPNI's social media channels where you can reshare Pharmacy First messages. So before you commence the service in your pharmacy, you should read the service spec and the service guide, and both are available on the BSO website or the dedicated Pharmacy First page on CPNI's website. All community pharmacy contractors meeting the service specification are eligible to offer the service provided they hold a contract with the HSCB. A signed copy of the contract should be returned to your local office by email prior to commencing the service. You must develop a standard operating procedure to support the delivery of the service in line with the service specification. Newmark and MPA will both be providing a template SOP for this service in Northern Ireland. Before the consultation, the pharmacist must provide patients with sufficient information to inform consent to avail of the service. Please read, review and sign the privacy notice provided, and it should be used to explain to the patient how their personal data will be used, and a copy should be supplied if requested. The pharmacist will seek verbal consent from the patient. In the interest of health and safety and infection control, there is no requirement for patients to sign any forms. Verbal consent will be necessary for every consultation, whether it relates to advice about COVID symptoms or another winter ailment. We have created a dedicated web page on CPNI's website where you'll find all the resources and materials you need to provide the service. This can be found under the Additional Services tab. Also, to keep you updated on deadlines and all correspondence relating to pharmacy services, please check out the monthly contractor calendar. While both aforementioned web pages are public, I would encourage you to sign up to the new website to access our members area if you haven't already done so. It will give you access to all the CPNI contractor emails. If you have any queries regarding the Pharmacy First service, please don't hesitate to get in touch with myself, Kerry Grimes, or speak to the pharmacy advisor in your local Health and Social Care Board office. Thank you very much for listening.